Hey everyone, thanks for being here. I'm Angie, and as you know, I normally talk to you about pensioner finance on Money Monday or chatty retirement subjects on Seniors Saturday. But now and again, something really important comes along, and I want to deliver this information to you hot off the press. So, what's all this about this morning with our UK healthcare this week? It seems like the government is about to unveil a brand new sweeping 10-year plan for the NHS. And it's not just policy speak or budget numbers. This could genuinely reshape how we all experience healthcare in the UK. The official announcement is coming on Thursday this week, Thursday the 3rd of July, but we already know a lot of what's in it. So I've pulled together everything confirmed so far, and in today's video, I'm going to walk you through the 11 key areas of reform. So stay tuned. Now, as we go through each one, I'll talk about what's promising, but I'll also be asking, is this realistic? Could there be unintended consequences? Reform number 1, shifting from treatment to prevention. So, first big change. The NHS wants to stop being reactive and start being proactive. It's not just about treating illness anymore, it's about preventing it. We're talking more vaccinations, regular screenings, lifestyle advice, even NHS-backed self-care tools to help us manage our own health. This sounds amazing, right? I mean, if we can stop people getting sick in the first place, that saves money, stress, and lives. Chronic conditions like diabetes and heart disease could be caught early or avoided completely. But here's something to think about. How do you actually measure prevention? Like, how do you prove that someone didn't get sick because of a new programme? And don't you think there's a risk that if we get too obsessed with prevention, some urgent or complex cases might fall through the cracks? Let's be honest, changing lifestyle habits is hard. No app or leaflet is going to magically make people quit smoking or walk 10,000 steps a day. So the big question is, will the NHS be able to support prevention in a way that feels empowering, not preachy? We'll have to wait and see on that. Reform number 2 is moving from hospital to community care. The plan aims to move a lot of care out of big hospitals and into local clinics, GP surgeries, and even homes. Yes, that's right, our homes. So we could be in for doctor's visits again in our homes. Things are certainly changing. They're reallocating £2.2 billion away from hospital deficit funding and putting it into primary care, especially in coastal and deprived areas. This makes a lot of sense. Most of us don't want to go into hospital unless we absolutely have to. I feel like that. It's far better to catch and manage things early in the community. What do you think? And if you live somewhere rural or remote, a strong local GP could be an absolute lifeline. Here's the but. Are those local services actually ready? Many GP practices are already overbooked and understaffed. So if we move more pressure onto them without building the workforce, isn't that just going to burn them out? And also, some patients do need hospital level care. Will hospitals lose too much funding in this shift? So yes, in theory, decentralising care is great, but will they actually invest in the community infrastructure fast enough to make it work? Because as yet, I've got no dates as to when they hope to implement this. So we'll wait to see what's happening on Thursday, and I might update you then. Be sure to subscribe so that you get it hot off the press on Thursday. Reform number 3 is happening in digital modernisation. Okay, tech lovers, this one's for you. The government is putting a whopping £10 billion into NHS digital upgrades. Really? Gosh. What kind of upgrades? Think AI-assisted NHS apps, virtual consultations, digital triage systems, and even voice tech that writes your doctor's notes for them. Wow, this does sound sci-fi. This could revolutionise things, in my opinion. And to be fair, some of this is long overdue. Digital triage could mean faster diagnoses, fewer wasted appointments, and better access for people in rural areas. Plus, if a robot can take notes while the doctor focuses on you, that's surely a win. But here's the thing, what happens to people who aren't digital savvy? For example, will older patients or those without smartphones be left behind? And let's not forget about cyber security. Would you be comfortable with AI handling sensitive medical records? It's a question that needs to be asked. So yes, the ambition here is clear, but it only works if we bring everyone along for the ride, not just the tech savvy. Reform number 4, cutting bureaucracy. This one's juicy. The plan is to cut almost 200 NHS bodies, including quangos. That's almost a swear word to us these days, and the money that gets poured down the drain. So 200 NHS bodies, including quangos, NHS England itself, and other oversight groups. The idea is to reduce red tape, bureaucracy, if you want it in a posh word, and direct more funding straight to patient care. Sounds good to me. And who hasn't complained about NHS bureaucracy before? Endless forms, committees, delays, it can be maddening. But let me play devil's advocate for a second. It's what I'm here for. Who's going to do all the coordination if these bodies disappear? Let's face it, healthcare is a complex beast. If you remove the people making the system run behind the scenes, don't you risk organisational chaos? Also, some real talk, some of these bodies aren't just red tape, they represent safeguards, patient oversight, quality assurance. So as long as they bear this in mind and make provision for those sorts of things, then trimming the fat is good. The question remains, are we cutting too deep, too fast? But then we're always saying something needs to be done now. So I don't think we can argue with that one. Reform number 5 is related to workforce reforms and recruitment. This one hits close to home for a lot of people. Staffing. The NHS wants to train more UK-based doctors. It wants to reduce overseas hiring to under 10% by 2025 and open up non-graduate medical roles for people from working class backgrounds. You know, that is refreshing, isn't it? For years, entry into medicine has felt elitist and exclusionary. Giving more pathways in is a huge step towards equity in my book. But will the NHS really be able to fill all the gaps with domestic training? Because right now, international recruits are holding the system up. Will non-graduate routes be treated with the same respect as traditional ones? Or will it create a kind of tiered workforce? Have to wait and see on that one. I do love the ambition here, don't you? But for this to work, we need to value every route equally and keep international hires as part of the mix for now, or at least for the next decade. I like reform number 6, which is faster approval and access to treatments. And it's one that all of us who've waited far too long for new treatments will love. And this plan will merge MHRA and NICE to speed up drug approvals by up to 3 months. Amazing, because that could be life-saving. Faster access to cancer therapies, rare disease meds, breakthrough tech. But here's the worry. Sorry, I have to keep bringing these buts in. In speeding things up, are we cutting corners? Drug approval is complex for a reason. It's not something you want rushed. So don't you think transparency is key here? Like, if we're going faster, we need clear data on how these drugs are being tested and approved. Moving on to reform number 7, and this one looks interesting, innovation in treatment. Now we're getting down to the nitty-gritties. The NHS also wants 1 in 8 surgeries to be robot-assisted by 2030. Plus, they're investigating in AI diagnostics, genomics, and personalised cancer vaccines. Honestly, that sounds like something out of Star Trek, but it's becoming reality. I can't help smiling because it all sounds amazing to me. The potential here is massive. Faster recovery, better precision, fewer errors. AI can even catch diseases before we notice symptoms. But tech like this is expensive. So, are smaller or underfunded hospitals going to get left behind? Will this become a postcode lottery? And do we have enough staff trained in how to actually use these systems safely? So yes, innovation is exciting, but it only works if it's equitable and widespread, not just in shiny new hospitals in London. And I knew this reform would be on the list. It's reform number 8. Tackling obesity and public health. The government's rolling out public campaigns to cut 50 calories a day from the national diet and making weight loss injections like Wegovy available over the counter without GP appointments. Now that could be a game changer because we know obesity drives up risk of stroke, diabetes and heart disease. And easier access to treatment might help those who are really struggling. And my heart goes out to all you overweight people. It really, really, really does, because I've suffered from this, not hugely, massively, but I know how the yo-yo dieting works and how we've all suffered on this one. But here I go again. Let's talk real life. Are we treating the symptom or the cause? If we just hand out injections without dealing with food poverty, urban design, sedentary jobs, aren't we missing the big picture? We can't run before we walk, can we? So what message are we sending out if injections become the go-to solution? This will work best if it's part of a wider strategy, I feel, on food, movement and health education, not just a quick fix. And another one which I've wanted to see tackled, and it's been on the list far too long, and that's reform number 9, mental health transformation. Mental health finally gets a major focus here. 85 new emergency centres, 8,500 new mental health workers, and expanded digital services. It's about time, right? Mental health demand is at an all-time high, especially among young people. But again, will we find and keep 8,500 professionals? Mental health services already face burnout and high turnover. Also, digital tools are helpful, but they're not for everyone. Some people need face-to-face support, not just an app or chatbot. So let's welcome this investment, but at the same time keep asking, is it deep enough, broad enough, and accessible to all? Reform number 10 is performance-based funding. This one's controversial. Hospitals will get some of their funding based on patient satisfaction and whether they keep patients healthy and out of hospital. Now that might motivate hospitals to provide better healthcare, better follow-up, better outcomes. But here's the catch. What if hospitals start prioritising easy wins just to boost scores or avoid high-risk patients? And let's not forget, not every patient is satisfied, even with perfect care. You can't please everyone, can you? I remember that saying from long ago. So it's a noble idea, and bring it on, of course, but we have to make sure it rewards the right behaviours, not just the popular ones. The final reform is health inequality and climate resilience. Yeah, very topical today, where our temperatures are shooting up to mid-30s. And I don't know about you, but I feel the heat so badly, as many older people do, and younger people, and those with illnesses. So let's look at this one. Last but not least, the NHS wants to rebalance funding to rural and coastal areas and prepare the system for climate shocks like floods, heat waves, and supply chain disruptions. Reassuring to know, isn't it? This is big picture thinking, and honestly, it's overdue and very, very welcome. But will these communities, these rural communities, get long-term investment or just short-term boosts? And are we really building climate resilience at scale, fast enough and enough to prevent deaths? This part of the plan needs serious follow-through, doesn't it? But it could make the NHS not just more equitable, but more future-proof. So some final thoughts for this hot off the press video today. In summary, let's look at this 10-year plan, which is, in my opinion, very ambitious. It's asking the NHS to move from analogue to digital, hospitals to communities, treatment to prevention, and bureaucracy to efficiency. And yes, all that sounds fantastic if the promises become reality. The big question is, will this plan empower patients and protect staff, or just stretch them thinner? Do let me know what you think in the comments. And what's the most exciting part of this plan for you? And what makes you nervous? And you know what? I've been dealing with money issues up to now, because the channel's called Money Wisdom with Angie. But this, in a way, is going to save us lots and lots of money, I think, in lots of different ways. So it's bound to be good for our budgets, and it'll, in the long run, cut down the huge cost that goes into the NHS. Please comment below, because this is really life-changing for all of us pensioners, everybody. So I really hope you'll gather round and get onto this one and show the government some enthusiasm and welcome it. It's a fantastic step forward. Don't forget to subscribe. Do share it if you found it helpful as well. And I'll be back with a breakdown once the full plan is released this Thursday, the 3rd of July. Thanks for watching and stay healthy and cool.